Sepsis begins outside of the hospital for nearly 80% of patients. 4 types of infections are most often associated with sepsis: lung, urinary tract, skin, and gut. Common germs that cause sepsis are staph, E. coli, and strep. My name is Lisa, and I am from Washington State. My dad died from severe sepsis 12 years ago, and I nearly lost my life to sepsis a year ago. Awareness is what saved my life, and I will continue to shout from the rooftops until everyone knows the word sepsis. I have battle scars. I am a warrior. I am a survivor. Please, just say the word sepsis.
258,000 people die every year from sepsis in the United States, and yet most have never even heard of the word. If you feel like you have the flu, but your heart rate is increased and your breathing is heavy, it is most likely sepsis. My name is Liz Deacon, and I'm from Tennessee. I survived septic shock in 2012. It started from a simple UTI, and yet I ended up with only a 20% chance of survival. Every day I have to overcome impaired memory, decreased energy levels, leg neuropathy, and insomnia in order to take care of my 3 young children. All of these are common side effects of sepsis called post-sepsis syndrome.
Although the population usually affected by sepsis are older, younger, or people with chronic illnesses, generally healthy people can be affected as well. That is what happened to my husband Jordan in February of 2017. Within 24 hours of his symptoms starting, Jordan went into septic shock, hypovolemic shock with multi-system organ failure. His liver and kidneys were shutting down. We later learned that this was due to a particular strand of E. coli. Jordan spent 5 days in the ICU and 12 days in the regular hospital ward. Sepsis affected his hearing. He lost his hearing in his right ear due to hypoxia, which in turn affected his balance and mobility. Also, sepsis affected his joints, where he ended up having a shoulder surgery to wash out the shoulder capsule, which had become septic. He is currently in rehabilitation and on strong antibiotics. We feel very grateful that Jordan survived this traumatic experience. Sepsis awareness is so important.
According to new research published by the Journal of the American Medical Association, sepsis is the most common cause of readmissions among conditions tracked by the Centers of Medicare and Medicaid Services in 30-day readmission rates. My name is Patricia. I am from New Jersey, and I am a sepsis and septic shock survivor. The way I got sepsis is from another condition called endometriosis, which I also feel needs awareness. Endometriosis caused a stricture on my right ureter, which led to hydronephrosis and a severe kidney infection. It also led to a UTI, followed by urosepsis, sepsis, severe sepsis, and finally septic shock. The way sepsis affects me is probably fear. Fear of getting it again, fear of not surviving next time, fear of getting it after any procedure or surgery that I have had or am going to have in the future for endometriosis. That is probably my biggest problem, and I'm sure that is part of post-traumatic stress disorder and post-sepsis syndrome.
Septic shock is the leading cause of death in intensive care units across the United States. My name is Nicole Taylor, and I'm lucky enough to say that I'm a septic shock survivor from New Jersey. How this happened to me? Kidney stones. Not everyone can pass them. I know I can't, no matter what size they are. Doctors need to listen to their patients. Kidney stones need to be treated more seriously. I was sent home with all the signs of sepsis. The very next day, at a different hospital, I was put into a medically induced coma, fighting for my life. I was hypoxic, hypotensive, and was not responding to antibiotics. A central line was placed, and I was started on 4 pressors. I developed hypoxic respiratory failure with severe ARDS. I was going to die. My heart rate was 170. My blood pressure was 43/32. If it wasn't for Dr. Dillinger's case study, Krista Shore, and the incredible staff at Cooper University Hospital, I would have been another statistic. Know the signs, know the symptoms, think, could this be sepsis? You could save your life for someone you love. So please take a second to share this video and help us spread awareness, because we don't want a family to ever have to go through what we did. Thank you.
Sepsis is the third leading cause of death, first in children. I'm Lisa Bartlett Davis, currently living in Colorado, but I'm from Kentucky. Last year, Sepsis Alliance recognized me as the 2016 Sepsis Hero. On October 20th, 2012, I lost my 40-year-old husband to sepsis. He was misdiagnosed with the flu, but 7 hours after he arrived at the hospital, he developed septic shock, and 16 hours later, he passed away. I was a 35-year-old widow with 4 kids, 2 under the age of 3. Jeff's children, biologically, were only 9 months and 3 years old at the time he passed away. I want you to know the symptoms of sepsis. I want you to tell your neighbors and your friends about sepsis. I want to save lives from sepsis. Help me raise awareness and save lives. Jeff developed OPSI, which is overwhelming post-splenectomy infection, which carries a 70% mortality rate because he didn't have a spleen. So if you don't have a spleen, or if you know somebody that doesn't have a spleen, please let them know about sepsis, and please let them know that they should talk to their doctors about prophylactics to keep them from getting sepsis.
Sepsis does not discriminate. It doesn't discriminate against age, race, gender, or faith. Sepsis can happen to anyone. Hi, I'm Heidi, and I'm from Illinois. I developed sepsis after delivering my first child during an unplanned C-section. The doctors perforated my bowel during the surgery and didn't know it. I was released from the hospital with the symptoms of a temperature, vomiting, low urine output, no bowel movement, and lower back pain. I went home for 8 days. In those 8 days, I saw 3 different doctors. Not one ever mentioned sepsis. I woke up one morning and could barely walk due to the back pain. I was admitted to the hospital with peritonitis, sepsis, and eventually septic shock. I spent the first month of my daughter's life, a little bit over, in the ICU and then in the step-down unit. Sepsis has changed my life and my family's. My husband and I can't have any more children. I also suffer from anxiety and have been diagnosed with post-sepsis syndrome. It is my plight in life to educate the medical field, doctors, nurses, CNAs, nurse practitioners of the signs and symptoms of sepsis and have them act on them. If they would have with me, my life could be different. Thank you.
Over 2 million Americans injected drugs in the year 2014. My son, Chris, was one of them, until he died at age 19 of septic shock, January 13th, 2014. Please say the word sepsis.
Up to 50% of all sepsis survivors suffer from post-sepsis syndrome. I am Lenita McCraney from Georgia, and I have survived sepsis.
Sepsis. Sepsis survivors, at least 50% of them suffer from some type of post-sepsis syndrome. My name is Rima Howe, and I live in North Carolina, and I developed sepsis in May of 2016 after coming down with pneumonia. I'm still struggling to learn to live a new me lifestyle, and I would just like for you all to become more aware of sepsis and all the dangers associated with it. Thank you.
In the U.S., sepsis takes more lives than AIDS, breast cancer, and prostate cancer combined. My name is Tori Pereira, and I'm from Marietta, Georgia. I was in septic shock due to a 2-inch perforation in my duodenum and was septic for about 24 hours before I went into cardiac arrest and laid on a restaurant floor with no pulse and no oxygen traveling to my brain for about 8 minutes. After being submitted in the ICU, it took the doctors 18 hours to finally make the decision to perform an exploratory surgery because I kept going into cardiac arrest and they couldn't figure out why. They cut me open from sternum to pelvis, pulled out all of my organs to clean and examine them. My surgery consisted of rerouting my stomach to the left side of my body. I had less than 1% chance of surviving my surgery, and doctors didn't expect me to eat a solid meal again. After my surgery, I was kept in an induced coma for 10 days where I was on 80% life support. I went through multiple blood and platelet transfusions and multiple dialysis treatments because I was in renal failure. 10 days in a coma turned into 15 days in ICU and 25 days total in the hospital. I spent roughly 4 months in extensive rehabilitation. Please help us bring awareness to the silent killer we call sepsis.
My name is Kimberly and I'm from North Carolina. Sepsis symptoms can often be mistaken for flu-like symptoms with the high fever, chills, body aches, and extreme pain. Other symptoms include a high heart rate, low blood pressure, mental confusion, and major organ malfunction. In 2011, I was admitted to ICU with severe septic shock. I spent 2 weeks in the ICU unit with the doctors telling my family on about day 3 that I wouldn't make it through the night. I had major organ malfunction, including my kidneys, my liver, my gallbladder, and my heart. My heart rate was at 160 and my blood pressure had bottomed out. Know the facts and help spread awareness. Sepsis doesn't discriminate. There's before sepsis and then there's after sepsis. It left me with post-sepsis syndrome, anxiety, and a major heart condition.
Sepsis can mimic the flu and the mortality rate is increased by 8% every hour untreated. Please know the signs because my family and I didn't. My name is Haley Smith and I'm from Colorado. My family and I watched my papa, John Ellison, battle sepsis. He woke up one morning with what we thought was the flu, but it ended up being septic shock. After 26 days, we watched his brain, his kidneys, his heart, and his lungs all slowly shut down. Then he ended his fight on my birthday, July 29, 2016. Please know the signs.
Hi, my name is Judy, and I am a septic shock survivor. And you really need to know your body, know sepsis. I was on my second round of Cipro and Augmentin when I went into septic shock. I didn't know what was going on with me. I had got very lightheaded. I was weak. I was extremely thirsty. I got disoriented, and it really scared me. I knew something was terribly wrong. I had the septic shock was Euro sepsis. I had a tube in my kidney because I suffered a gunshot wound, and it took out part of my ureter, and that's how that came about. With a gunshot wound, I was in the hospital for 2 months, and then I was home 2 months, went to septic shock, and in the hospital for 2 weeks. My temp was like 106. My blood pressure was, I don't know, 70 over 22, something crazy like that. Like I said, disoriented. You really need to know your body, know sepsis. And I know this probably whole thing didn't make sense, but I hope it helps someone. Thank you for listening.
I survived sepsis. I was one of the lucky ones. Even when you survive sepsis, you could have lingering physical issues. We call that post-sepsis syndrome. Doctors don't understand it because sepsis can affect bodies differently. We need answers, and you should too, because you can get sepsis from any infection. Any infection. My name's Kim, and I'm a 4-year survivor of sepsis.
Only 55% of Americans have heard of sepsis. but very few of those know anything else about sepsis other than it is life-threatening. I'm Jill Cogan Blake, and I live in California. When I experienced the worst pain ever in my stomach, I was scared, and I had never heard of sepsis. When I woke up 5.5 weeks later with a perforated bowel, 25 pounds thinner from a morphine-induced coma, a tracheotomy with a breathing tube in my neck, a feeding tube in my nose, 7 tubes in my abdomen, my skin the color of burnt sienna, unable to utter a word, and too weak to lift a finger. I was even more frightened, but so grateful as I learned that I had miraculously survived the searing inferno that is sepsis and septic shock. This was the most difficult test of my life, but with an enormous amount of help, love, and care. I underwent several more surgeries and months of rehab, and I have completely recovered. Now, full of wonder and gratitude to be a survivor, I have made it my mission to educate as many people anywhere and everywhere about sepsis and to help find and support innovative diagnostic, treatment, and care solutions. We must learn to suspect sepsis and to save lives. We must.
Sepsis. Sepsis is an overwhelming, life-threatening response to an infection. It can lead to tissue damage, organ failure, and death. Hi, my name is Donna. I'm from California. I went in for a routine colonoscopy, and my colon was perforated. I came down with sepsis. Sepsis left me with my lungs working at 55% and many other post-op issues. You could save your life or someone else's. Over 258,000 U.S. Americans die yearly.
Hi, my name is Erica, and I'm a 2-time sepsis survivor stemming from kidney stones and discitis in my spine. Thank you for watching our video. Nicole Taylor and myself wanted to band together other survivors and people who have lost loved ones to sepsis to bring awareness to this global killer. We have a lot of people in the medical industry championing for us, but we need a whole lot more. People need to know about sepsis and need to know that it's killing people daily, worldwide. And a lot of those are children. So please share this video with everyone you love, and follow us here on Facebook at Sepsis Awareness Video. Follow us on Instagram and Twitter at SepsisAVUSA, and together we can shut down sepsis. Thank you.